welcome back to my channel. So I'm sure you guys are wondering, where the heck am I? I'm at the airport. It's 5 in the morning, flying to Korea today. I'm not making any sense. I have not slept at all. I drank 2 Starbucks. My mind is awake, but my body is dying inside. So right now I have arrived in Seoul, Korea. I think I gotta meet my driver over there, right? Okay. I know I'm like super tall though. That's why I used to model. Oh, sorry. Okay, it's very nice to meet you. So let's get going. I've arrived at my hotel. It's this building right now, and this is the car I was in. K-pop idol style. Oh, I feel so bougie right now. Okay, let me get ready. I'll show you guys my hotel room once I get in. I'm in my hotel. This is really nice. I'm like kind of shocked that I'm in Korea. The sink area right here, very nice. Ooh, yes. Right now it's 6 in the morning. I actually never get up this early. And the place I'm staying at is called Cappuccino Hotel. I'm heading out to meet my road manager from Docfinderkorea. I'm very excited. Got my shades on because, girl, I have no makeup on right now. The door is opening. Nice to meet you. Hi, so this is Anna from Docfinderkorea.
Yes.
Nice. Docfinderkorea is a medical tourism agency in Korea. Their services are free, but it doesn't affect your surgery fee. Clinics charge the same surgery fee to you even though you come to the clinic yourself or you come to the clinic through Docfinderkorea. And from my own personal experience, Docfinderkorea is the best place to go to when you're traveling to South Korea for cosmetic or medical health treatments, as they're the most trusted source in finding and matching you with a clinic based on what you request to get done. They are able to help you become beautiful or to treat a disease in the most proper and trusted place is the purpose of medical tourism. They provide the best medical services to their clients by selecting the most suitable doctors and hospitals based on what you want to do and which place is best suited for your medical needs. They also work with people from all over the world who are in need of medical treatment. Clients who are using their services have an access from any country by email correspondence, phoning, or through their on-site branches and partners. For more information, I will leave their contact information in this video and also in the description box below. Now, me and Anna are in front of G&G Clinic right here. This is where I'm gonna get snatched and look amazing and look gorgeous right here. G&G. The consultation will be like a few hours.
Right, around 2 hours.
2 hours? Okay, cool.
There's like many things you need to do, taking pictures and then talking to the consultant, talking to the doctor.
To make sure my face looks exactly what I want.
Right, so that's why.
G&G Plastic Surgery Hospital specializes in the face, so if you are thinking of getting work done solely on your face, then G&G is the best choice. As I arrived, I spoke with Hazel, G&G's English interpreter, as she explains what we will be doing for the day. First, I am getting my whole face scanned so the doctors could see my bone structure and nerves so they can review what they are working with. Health and safety is G&G's top priority for their patients, and it was pretty chill in there. They put on classical piano music as I was getting scanned. It was pretty relaxing. Next, they wanted some x-ray scans, and the nurse was really helpful to make sure my head is steadied correctly so they can scan my jawline and see what is going on. After that, we went to the next room to take some photos of my face before surgery. And girl, this is my favorite part because this is where I can really see the before and after results. And I'm like shook because I'm so excited to see what my end result will look like compared to the before. The nurse had me face different angles so the doctors can review and discuss what they can do for me basically. After the scans, x-rays, and the mini photo shoot, we went back to the 3rd floor to talk to G&G's consultant where I talked about what what my concerns were and review what we will talk about with each doctor individually. The consultant was very thorough in explaining the process and what are the most realistic results post-surgery. She also took a lot of notes for the doctors to review and discuss further when I met up with them individually. The first doctor I'll be seeing is Dr. Choi, who will be doing my facial contour. Dr. Choi pulls out my scans and informs me that some of the nerves are really close to my jawline, so he would not be able to do the full V-line procedure, and I was pretty disappointed because I was looking forward to it, but Dr. Choi wanted what's best for my health and safety, because if I went through with it, girl, it'll cause nerve damage, and that was something Dr. Choi and G&G wanted to avoid doing. So instead, he can reduce my jaw a bit and shave the sides of my chin so it'll be smoother. We also decided cheekbone reduction wouldn't be the best fit for me, as Dr. Choi thinks it will make my face a bit flat dimensionally. The second doctor I am meeting is Dr. Sung, who will be doing my rhinoplasty and tipplasty, because girl, I need a new nose. I not only have a hump on my nose, but also a bulbous nose tip, and I explain my concerns with my nose as Dr. Sung takes a look at my scans and my photos. I found out that I have a deviated septum inside the right side of my nose, which caused majority of my breathing problems that I thought was just bad allergies, but girl, I always knew deep down inside something was wrong with my nose. He can fix during surgery to help me breathe better. Dr. Song explained that he will shave down my nose bridge and use the cartilage of my nose tip to shape my nose, but during surgery he will see if I'll have enough cartilage, and if not, he could remove some from my ear. I also asked if I should get a silicone implant as well, and Dr. Song said he will try and see if it looks natural on me during surgery, and if it doesn't look natural, he won't put it in, and I basically will be rocking all natural. So basically he will just be fine-tuning my nose a bit. The last doctor I'll be seeing is Dr. Kim, who will be doing my fat grafting surgery. As this was my first time hearing about fat grafting, Dr. Kim explains and reassures me that fat grafting will basically be taking fat from my body and purifying that fat to be injected to certain areas of my face. I also explained my concern that I look a bit older than my actual age, and Dr. Kim suggested injecting fat underneath my cheekbones to smooth out my appearance, and Dr. Kim will be injecting my chin area to produce a V-line shape for me, as she noticed my chin is a bit flat, let's keep it real, and I couldn't get an implant because my bone structure couldn't make it work. And lastly, she will be injecting my forehead to help balance my nose and give it a smooth slope side appearance. And girl, I'm just shook. I'm so ready. Hey, so today is day 3 of my stay in Seoul, Korea, and today is September 15th. It's around 7:30 in the morning, and today is the big day. I'm getting my surgeries done on my face. It gets snatched with the guts. How am I feeling right now is I'm kind of nervous, very nervous. I will be in the surgery room for around like 9 hours. This is it. My face is gonna slightly change. I'm a little anxious, but I know everything will be okay. Face looks like right now. Okay, so there is a bump right here. I mean, I don't think you guys can see that well. So when I have makeup on, it doesn't look like I have a bump because I contour the living daylights out of it. But my nose. And I just want to let you guys know that if you are getting plastic surgery, don't try to look like someone else or a celebrity or something, because at the end of the day, you just gotta look like you, the enhanced version of you. Wish me luck, you guys. I will update you guys on the recovery process, how I'm feeling, and you guys will know what's the 411. As I arrived at G&G Hospital with Anna from Docfinder Korea, I was immediately taken to the 8th floor where I was given a room during my recovery stay after surgery. This is where I changed into my surgical gown and where I needed to wash my face as well. This is where G&G prepared the proper face wash for you to use before surgery, so do not wash your face before you arrive to the hospital, as the hospital will provide the proper face wash for you to use. I met with my consultant one last time to go over what we talked about yesterday and making sure we are both on the same page as well as signing papers. And don't worry, the consultant will tell you what you will be signing. And of course, the papers will have English translation as well. So make sure you read and ask questions. My consultant was very helpful and thoroughly explained everything to me, so I feel more at ease moving forward. Of course, I will be meeting my doctors one last time before surgery just to go over what we talked about. The first was me meeting Dr. Choi, who was doing my facial contour, to go over what we plan to do and also informing me that we are not doing cheekbone reduction, as I'm also doing fat grafting with Dr. Kim, which will help my overall appearance and my desired V-line shape. Girl, bless. Dr. Choi also explained that I already have somewhat of a V-line structure, but simply need a bit of fine tuning. So he is only going to cut off a small piece of my square jaw on both sides, of course, and then shave my square chin to be more round on the edges. Thank the Lord, because them photo angles could only help me so much, and I needed this. The next doctor I'm meeting is Dr. Song, and he is the one doing my rhinoplasty and tipplasty. Hazel was very sweet and considerate and printed out my photos from Instagram, which I totally photoshopped my ideal nose for the past 14 years of my life. And Hazel totally caught on to that, so she gave my photographs to Dr. Song for inspiration while working on my nose during surgery. And after we went over what Dr. Song and I discussed yesterday, I was extremely confident and excited because this is something I've been wanting for the past 14 years. After we went over and agreed what Dr. Sung will be doing, he did mention he will try the silicone implant on my nose as I requested, and if it didn't look natural on me, we won't be using it. After that, Dr. Sung just drew some markings on my nose, and the magic is gonna happen in the next few hours. Girl, I was shook. I was quaking in my G&G sandals. The last doctor I was meeting is Dr. Kim, and we went over again with what she will be doing during surgery. She marked areas on my face and body so she knows where the fat grafting is coming and going towards to give me that youthful appearance and turn back time, because girl, G&G be doing God's work and making miracles happen. I got my face all done up, marked up, and ready for surgery. This will help the doctors see what they're trying to do, and this is Hazel. And I'm here with Anna. Jay was back here. Very, very excited. Surgery room right here. I'm a little bit nervous. I just met with all my doctors. I'm excited to see my final result in 3 months. So I signed my life away. I will see you guys on the end of the magical rainbow unicorn side, of the other side of my life. And with that, I went in and was knocked out in less than 3 minutes. And basically, I just closed my eyes and then I woke back up like, girl, what happened? I'm shook. I got bandages on my face. So if you want to see part 2 of my surgery and recovery journey, because girl, the recovery, the struggle was real, please give this video a big thumbs up, subscribe, and turn on that notification bell so you will know when I will be uploading the next part. If you want to reach Docfinder Korea, I will leave all the information in the video and also in the description box below. And until next time, may courage be your wings.